Hi, I'm Amy Perlman. I'm one of the doctors here at the University of Iowa Hospitals and Clinics. Right now, many people may be worried about going out anywhere, even to see their doctor. We understand. We also know that it can be even riskier to put off taking care of your health. That's why we are committed to safety now more than ever. I want to show you what you can expect when you come to see your University of Iowa healthcare doctor. I want you to see how safe we've made our hospitals and clinics. After you see how safe it really is, I think you'll be more confident about coming in and getting the care you need. So let's get started. The first thing you should know is that we are reducing the number of people in the building. That affects who can have a visitor. Check our website at uihc.org for the latest information on visitors. You know how important physical and social distancing is, and restricting visitors helps everyone to keep that up. The second thing you should know before you get here is that all of our patients and visitors are wearing masks. If you have your own mask, you should bring it with you. If you don't have one, we'll give you a mask or shield to wear. When you arrive, you'll notice that everyone who works for UI Healthcare is wearing a face covering. Anyone who has direct contact with you will be wearing a face shield plus a mask. That includes the screeners at the door, the people who check you in, and your provider. This protects them, and it protects you. You'll also notice that we only have a few entrances open. That's so we can health screen everyone coming in. You'll also have your temperature checked by one of these. It's a thermoscanner. It's a way we can check your body temperature for fever without any physical contact, so you may not even realize it's happening. And it's not just patients who get screened. Everyone gets screened, including me. Once you enter the hospital, it shouldn't be long before you see a hand hygiene station. These are for everyone. Please use them frequently. Or, if you prefer, stop by a restroom and wash your hands for at least 20 seconds with soap and water. You'll also notice that we have lots of reminders to stay 6 feet apart. In places where people line up, or where it might get crowded, we have markers to remind you to physical distance. This is what it typically looks like. Plenty of room for you to keep at least 6 feet apart from others. When you get to your clinic, the first thing you'll do is sanitize your hands again. Then you'll check in. We try to make this go as quickly as possible. If you have MyChart, you can use the e-check-in feature anytime before your visit to make it even faster for you. If you do have to wait, every clinic will have more reminders and markers to make sure everybody stays at least 6 feet apart. After you check in, the waiting room will look something like this. Either the chairs will be moved apart, or some of the seats will have signs that make sure you physical distance. You won't have to do the extra work of finding a safe spot. We're going to do that for you. During your appointment, your provider will likely need to be closer than 6 feet from you to assess your health. They'll be wearing personal protective equipment like this, and they'll practice hand hygiene. After your appointment, when you're leaving the clinic, sanitize your hands again and follow the signs to an approved exit. There are a few things that you might never see, but that we want you to know. First, our cleaning crews are continuously cleaning and disinfecting surfaces all over the hospital. They've received extra training and are taking extra steps throughout the hospital and clinics to make sure it is clean and safe. Second, we are following national and statewide guidance on personal protective equipment, or PPE. Our staff are trained in how to use and conserve PPE so we can be sure to have enough to safely see patients now and in the future. And third, we have a full team of hospital epidemiologists who are nationally known experts in all of the best practices for protecting hospital patients from infection of any kind. They help guide everything we're doing to keep you safe while you're here. And they help us continuously evaluate what we can do to keep improving safety for our patients and our employees. There is no higher priority. I hope you can see just how serious and thorough we're being. We believe UI Hospitals and Clinics is one of the safest public places you can be at this time. We are doing everything we can to make it safe enough for our employees and for you to come here if you don't feel well or if you need ongoing specialty care. And we also know that encouraging you to get the health care you need is the right thing to do. We want to see you here. If you're still not ready for an in-person visit, at least make the call to your doctor to talk through your options. Ask your doctor if a telehealth video or phone visit is right for you. Please, don't put yourself at risk for health complications. Take control of your health. Call your doctor today and get the care you need. UI Healthcare stands ready and safe, and we are ready to safely care for you.